Welcome to today's American Community Media Briefing. I'm Selene Osterk, ACOM Research Director and your moderator for today. And today we're focusing on a vital but often overlooked topic, underutilized Medi-Cal benefits. Even though Medi-Cal offers full coverage for routine checkups, cleanings, and eye exams, only 1 in 5 adults use their dental benefits each year. These aren't just routine services, they're essential to preventing serious health issues like tooth decay, infections, and vision loss. Left untreated, these conditions can affect a person's ability to work, care for their family, and maintain their overall health and well-being. And now we'll begin with Donna Durham, Chief of the Medi-Cal Dental Program, who will share what dental services are available, who qualifies, and why it's important to use a dentist regularly. Donna, please go ahead.
Thank you so much. So glad to be here. Excited to talk to you about dental benefits. Dental benefits are a benefit that comes with qualifying for Medi-Cal. So when you qualify for Medi-Cal, you also qualify for Medi-Cal Dental. Children under the age of 21 are guaranteed coverage, and that really syncs with federal law. And in 2018, California elected to offer dental benefits to adults. So the benefits are for everyone who is eligible for Medi-Cal right now. That includes right now undocumented individuals and those with other immigration statuses. I'll talk a little bit later about some changes that'll be upcoming to that, but just wanted to really emphasize that it is a benefit and dental is important. Dental really is part of CalAIM. As y'all have been in these discussions, you've really learned that CalAIM is intended to treat the whole person, and that's their medical issues, mental issues, social issues, but also dental issues. CalAIM encourages providers to focus on keeping people healthy, not just treating people after problems happen. So we are really looking at preventive care more than reactive care, so that we can help people from getting to a point where they get really sick. We want to make the care consistent and accessible. And we're doing that by working to improve access and really working on quality, as well as trying to align our services with national standards or what happens with the commercial industry. So we do that as best we can. Some of the things specific to dental that are a focus in CalAIM are the preventive care, and that would include things like fluoride varnish, and that's helpful usually for kids, and also sealants, and education about oral health. We also promote dental homes, and that means going to the same dentist, being able to keep that dentist so that you don't have to find a dentist every time you have an issue, but going to someone who has been caring for you and is familiar with what's going on with your oral health. There's silver diamine fluoride, and that stops tooth decay without drilling, and that's usually pretty helpful for younger children and older adults. And then finally, carries risk assessment for children 6 and under, and that tailors really based on individual risk, and it allows for more frequent preventive services. So let me tell you just the things that are covered with full scope Medi-Cal dental services. That includes checkups, cleanings and x-rays, filling, root canals and crown, gum care and deep cleaning, dentures, that includes full and partial, braces for qualifying children, emergency care for pain or infection, dentures, both full and partial for missing teeth, as well as anything that is medically necessary. So not everything is on this list, but if something is medically necessary, it is able to be a Medi-Cal benefit. There are certain instances in which people qualify for implants, but not always. I do want to talk a little bit about some changes that are coming up, and they will start on July 1st, 2026. And as I said, that's July 1st, 2026. Most members are not going to know there's a change. But there will be a change to adults who are 19 years or older who are not pregnant and have certain immigration statuses. The immigration statuses that are impacted by this include those undocumented immigrants, individuals who have a green card for less than 5 years, people who are permanently residing under color of law, also known as PURCOL or PRUCOL, qualifying through a state expanded expansion or humanitarian program. So someone who's qualifying because they're a victim of trafficking or crime, or have another immigration status that does not qualify for full scope Medi-Cal. We're going to drop a link into the chat with a chart that shows what immigration statuses do not qualify for full scope Medi-Cal under federal rules. So after July 1st, 2026, adults, that's those who are 19 and over, who are not pregnant, and in those categories, will only qualify for emergency dental care. And emergency dental care are things like you've got an infection or you have really bad tooth pain, and then you can get those services covered. Children, that's anyone under the age of 19, and people who are pregnant will continue to receive full scope dental benefits regardless of immigration status. And that's individuals who are pregnant up to a year after giving birth. And just want to make sure that that's clear, and we'll really interested in making sure that we are able to cover everyone who needs care. So if you know someone who's undocumented or who has an immigration status that will lose their full dental benefits in July 2026, we really want you to work on having them use those benefits. There are community health workers that work specifically in dental areas, and they're available with many dentists work with them. And so do want to make sure that if you need help or someone needs help navigating, they can ask for that help. So how is Medi-Cal Dental done? Well, it's done in two ways. One is managed care, and managed care is mandatory in Sacramento County and voluntary in Los Angeles County. And then there's fee-for-service. And so the Smile California site is fee-for-service, and that's where you find the dentist, the website that says if you find a dentist. And most places in California are in fee-for-service, and that really means you can go to any dentist who accepts Medi-Cal without needing to join a plan. So if you're in a plan, you contact your dental managed care plan if you need help. And in fee-for-service, you'd use the provider search directory, and I'm going to ask someone to put that in the chat, as well as the Medi-Cal Dental Member Services Center. As I said, there are community health workers that are available in dental, and those are trusted members of the community who help patients understand their benefits, make appointments, and overcome barriers like if you're having an issue with language or transportation, and that's really a step towards making dental care more culturally responsive. And why this is really important is because a lot of people don't know that they have dental benefits through Medi-Cal. And these services really are meant to help prevent pain and avoid costly emergencies and support overall health. Your oral health really is tied into your physical health, and it can be an indicator of when there are other physical health problems. And so we just feel like that's such an important thing to get your overall health taken care of, and really want to appreciate your key role in spreading the message that dental benefits are available. Dental really offers important benefits that help keep our families and community healthy. And sometimes people don't know they have them. So if you know someone who can use dental benefits, these services are available and they are at no cost to eligible members. So if someone goes to a Medi-Cal dentist, they do not pay. So we just ask that you talk to your family, your neighbors, your community, and let them know that dental care is part of Medi-Cal. And if you know anyone who's a dentist, we also would love for you to help them become a provider in Medi-Cal Dental. And the more we get this information out, the more we can help people stay healthy. But just really appreciate the ability to talk about this.
Thank you so much. That was fantastic. And it's related to a few questions I'm getting to the effect of dental care is so universally important. Why are enrollees low for this benefit? So, like, would it be fear of going to the dentist or not knowing it's available or the shortage of dentists you mentioned?
Probably a combination of all of them. And we are working to make sure we get more dentists enrolled. That's really an important thing. When someone enrolls in Medi-Cal, they're told about dental, but it is not as prominent. So we do want to make sure that everyone knows that they have the ability to go to a dentist. And just want to make sure everyone knows that dentists are available. And just sometimes people say that they can't find a dentist. We have that Find a Dentist tool, but we also have started care coordination as well as community health workers. And what care coordination is if you have a really hard time finding a dentist or you have some really complex dental issues, then Smile California will help you specifically get those appointments and coordinate what is needed. So that's why we put the phone number there as well as the Find a Dentist, so that we can make sure that people get the help they need to navigate to dental care.
Great. Question above that, why are dentists more reluctant than other doctors to take Medi-Cal? If they are, that is.
Well, I'm not totally sure they're more reluctant, but sometimes you do have dentists who have had a hard time. One of the things was it was more difficult to enroll in as a provider, so we have streamlined that. We've worked really hard over the past several years to make becoming a provider in dental easier. So we work really hard to do that. And we also, some people are afraid that they'll get a lot more members. So sometimes we've worked with providers to make sure that if they don't want their name in a directory, they can be referral only. So we work really hard with providers to get them to be Medi-Cal providers.
Okay. And a related question from Araceli that concerned both services, so I'll ask it for dental. Why do you think many older adults aren't aware of dental services? And why at this age is it more important than ever to take care of our dental health? How can this lead to other conditions or worsen them?
That is an amazing question and really appreciate you asking it. I think people just aren't aware, probably because they've been in Medi-Cal before. Dental was available to adults. As I said, we've only had that since 2018. So it's really important that we continue to spread the message of dental being available. I don't know if you've ever gotten the packages from Medi-Cal, but there's so much information in there. Sometimes it's a little hard to wade through. And so just want to make sure that we continue to spread that message. As far as oral health in older adults, it really is tied to overall health. And I'll give you a little example of what that is. Sometimes if you have bleeding gums, then what happens is that your bleeding gums are sometimes an indication that you might have diabetes or be headed towards diabetes. It's not always, but it's often tied. There are other things that bad oral health will lead to having potential problems with, and that's some cardiovascular issues and other things, and we're working really hard to integrate oral health with physical health long term.
Wonderful. And a question from Tanae Gokale. The perception is that dental care is often expensive, even if it is covered by insurance. How do Medi-Cal copay/deductibles for dental care compare to other insurance providers in that regard?
I love that question, and thank you for asking it. First of all, a Medi-Cal member should never be paying for dental care. And let me state that again, a Medi-Cal member should never be paying for dental care. Why that is so important is sometimes most, even in commercial, coverage doesn't cover all of a dentist's care. Like, I don't know about you, but with me, I have to pay more when I go to a dentist, and like they won't always cover all of a crown or something like that. So I often have a copay with it. Well, when you're working with a dentist, they can't charge for a copay or anything. So just want to make sure that people are aware that if something is medically necessary and appropriate, then Medi-Cal will cover that. Sometimes the dentist has to ask us if it's medically appropriate and necessary. So that would mean that you have to go to the dentist twice, first to get looked at and get diagnosed, and secondly for the follow-up treatment. But you should never be paying for dental through that.
Wonderful. What a message. And one more, since everyone may not have a sense what it means that you're, bolstering these services through CalAIM, what is the difference between Medi-Cal and CalAIM, and when did the CalAIM initiative start?
I cannot give you exactly when the CalAIM initiative started, but it historically goes back before our first waiver that got into that, and our first waiver that authorized CalAIM as a formal program was in 2020, but there were a lot of things that led up to that. And CalAIM is really a reforming of Medi-Cal overall, and what I mean by that is before everything was a little disjointed, and we really kind of often began working with people on reactive care. And the point of CalAIM is to see a person as a whole person. What's going on with you? How do we help you get treatment before you start showing signs? And how do we help really get you to the point that you are able to access care before you get sick? It really is a transformation of Medi-Cal overall.
Thank you. Now, please join me in welcoming Eileen Espejo, Senior Managing Director of Health at Children Now. Eileen has been a leading voice in expanding access to medical and dental care for children across California. Through her work at Children Now, she's championed both legislative advocacy and on-the-ground initiatives, including school-based programs that bring oral and vision health services directly to students where they learn and grow. Eileen, we're very excited to hear from you. Please go ahead.
Sure. Thank you so much for having me. I really want to shout out to Department of Healthcare Services for the great partnership that we've enjoyed between Children Now and the agency to really make sure that services are reaching children in California. So I, at Children Now, lead our oral health policy and advocacy efforts, but where it makes sense and where I've actually channeled my health team colleagues, I will also speak to the vision care that Dr. Shu had covered earlier. What I want you to know about oral health, and as you've already heard from Dana, is that it really is a gateway to overall health. So when it comes to a child, if a child has untreated tooth decay, or if a child has tooth pain, that can lead to difficulties in both sleeping, it can lead to difficulties in eating, it can lead to difficulties in talking and speaking, it can lead to difficulties in concentrating, say on a school lesson, for example. Chronic absenteeism and poor oral health among children, there have been studies to show that children with oral health problems actually have lower academic performance, in part because they're having toothaches, or they have tooth infections that they're suffering from, or they're missing school because they're just not there. And who are taking the children to these appointments are parents who are then not working. So you can kind of see the cascading effects that one's oral health can have. But from the perspective of a child, it also affects their emotional health too, right? Like if you're a child and you have cavities, you might feel a little bit less shy about engaging with your peers, or you might, one, be in pain, but you also might just not feel like you're going to be social. You might feel like you can't smile. You might feel that if your teeth are have cavities, that it's not like a safe space. There are a number of areas of a child's life that are impacted if they have poor oral health. And that is why, if you can we'll take several messages from today, but one message is really across the board that prevention is key. We don't want to see kids in pain. I did see something in the chat about, even children as young as 1 year of age or 3 years of age are showing up with cavities, and that is heartbreaking. In these cases, we really encourage parents and caregivers to bring their child not just for regular dental checkups, but also for regular just child visits. Dana had spoken about medical dental integration, and we know that a new parent is more likely to bring their child to a pediatrician more often than to, say, a dental provider, which makes sense. So we at Children Now work really diligently to improve medical dental integration, to really figure out how can we educate primary care providers to be that trusted source of information and to be that messenger to parents to say, hey, do you have a regular source of dental care? Do you have a dental home? If not, here are some resources. We think that's really important because perhaps a parent is going to trust that message coming from their medical provider. Not to say that dentists don't play a role, that hygienists don't play a role, they absolutely do, but just trying to reinforce the messages that parents and caregivers can act upon. I also want to make sure that you all are aware that children, no matter their immigration status, are covered in Medi-Cal. So all the Medi-Cal changes that Dana had referred to earlier does not impact children under the age of 19 who are enrolled in Medi-Cal. So it's really key to make sure that our children, all of whom are income eligible for Medi-Cal, are getting access to all the services that they're entitled to through Medi-Cal, which includes dental and vision. The tie I want to make to vision specifically is that similarly to oral health, if a child doesn't have great vision, then they're also going to be suffering from possible either social isolation or academic performance, certainly if they're not able to see clearly. So it's really important that problems do not go undiagnosed and untreated. And again, prevention is key. The other thing I want to point out, and I'm happy to share these in the chat later, but there are a number of resources available for parents. There's a new parents kit that First Five California puts out. It's in multiple languages. This is something that can be shared far and wide. so that they understand the importance of cleaning their child's teeth, especially for newborns. Newborns, even though their teeth may not have emerged, still really important to even just wipe down the gums after breastfeeding or after bottle feeding. So some parents may not know that, but it helps set the foundation for healthier teeth to come in when you have clean gums. Another good resource that I've seen is called Brush Book Bed, also available in multiple languages. So Brush Book Bed is a practice that a lot of local health departments through their local oral health programs are trying to promote to all families and communities, where the parent, caregiver, and their child are bonding through going through a toothbrush routine and then reading a book together and getting that child ready for bed. You'll notice that I didn't mention anything about a bottle for younger children. That is because there are some practices which don't help promote oral health so much. And one of them is putting a child to bed with a bottle that actually, depending, of course, what's in the bottle, which is usually formula or breast milk, that does promote tooth decay if you're not wiping down that gum right away. It's not a best practice. But trust me, as a parent of older children, but it was much easier to be able to put my child to bed that way, but we needed to, use a pacifier instead of a bottle. So there are several resources out there for parents and caregivers, but if anything, I just want people to understand that prevention really is key. We don't want to wait to see a child in pain from something that's preventable. I'll stop there, Celine, and sorry again for speaking too fast at the beginning.
It'd be the opposite of sorry. That was fantastic and a great final message. I'd say if you're entitled to benefits, use them now when help is available, and when you're setting good habits early on, adults set the model. Thank you so much to all our speakers. I want to give special thanks again to our partners DHCS and Eileen with Children Now, and thank you to all our reporters for joining.